Hello, my name is Kurt Snyder. I am a part of Project Group 3 alongside Grace Walkerdine, Brittany Shepard, Caitlin Gibson, Katrina Baker, Tatiana Williams, and Sanad Malkawi. Our presentation, entitled Insulin Management, depicts a hypothetical scenario in which a patient is diagnosed with diabetes and some of the information that would be provided to them by nursing staff. Diabetes is a complicated disease, and this presentation does not aim to outline all information a patient would need to know and instead focuses on important general information regarding insulin management. We begin with an overview of our hypothetical patient's health history. Our 20-year-old patient has a long family history of diabetes, and they also exhibit some symptoms of diabetes. Identifying symptoms of illnesses within a patient and corroborating them with a family history is important to ensure appropriate tests are conducted and medical conditions like diabetes can be properly addressed. In our hypothetical scenario, the patient is tested using a hemoglobin A1C test as well as a fasting plasma glucose test in order to determine their diabetic status. The use of multiple tests is crucial in scenarios like this, as false positives and negatives can lead to serious health complications if any action is taken based on their results. Explaining complicated conditions like diabetes to patients at a level which they can understand is crucial in the nursing field. Teaching a patient about their condition and how it affects their body can help them grasp the importance of treatment. Patients who don't truly understand the effects of diabetes and low insulin may not see a need to bother managing it. In the case of our hypothetical scenario, providing baseline explanations of what hormones, and by extent insulin, are helps her to better understand her condition. Diagnosis may be daunting to some patients, and providing information about viable treatments for their condition is also important. Communicating solutions to a patient's problem is just as important as communicating the problem. The problem for our hypothetical patient is insulin, too little insulin to be precise. Insulin is a hormone that regulates blood sugar levels, the storage of glucose, and the metabolism of carbs, proteins, and fats. Diabetes is usually manifested by complications within the body. Type 1 diabetes typically involves a lack of insulin being produced in the pancreas at all, while type 2 involves a body's inability to properly utilize insulin. The body's poor regulation of blood glucose levels and other vital roles of insulin being unfilled can cause serious health complications within the patient. Some of the risk factors associated with untreated diabetes include, but are not limited to, increased risk for heart attacks and strokes, heightened risk for vision issues like glaucoma, severe nerve damage, most notably in the feet and legs, complications with the kidney, as well as deterioration in both teeth and gum health. One advantage of thoroughly understanding a disease is the ability to outline all of the problems that can arise from ignoring it. Presenting a patient with all of the bad things about a disease can help them understand the importance of properly treating it. A typical treatment for diabetes involves the introduction of insulin into the body. There are several different types of insulin: rapid-acting, short-acting, intermediate-acting, and long-acting. These different types release varying amounts of insulin into the body over different intervals of time. Without going into too great detail, the chart here provides a general overview of the differences between the different types of insulin. In addition to types of insulin, there are also different methods of receiving insulin. There are insulin syringes, insulin pens, jet injectors, and insulin pumps. All of these devices have their own applications in regards to treating diabetes, but the specific details behind their function goes beyond the scope of this presentation. In our hypothetical scenario, the patient has elected to receive long-lasting insulin and use an insulin pen to administer injections. It is important to remember that patients always have a say in what treatment they receive, and that it is the job of the nurse to inform, not enforce, treatment. With this decision in mind, the nurse in our hypothetical scenario needs to communicate the importance of daily insulin dosage and blood sugar monitoring to the patient. Follow-up visits for lifelong conditions like diabetes are also extremely important, and the patient needs to be made acutely aware of this as well. On screen now are some questions that can be used to gauge both your or the hypothetical patient's grasp of the knowledge provided. Talking at a patient is not necessarily a useful way of communicating serious information to them. Involving them in the process can help them make better informed decisions in regards to their health. A few resources used within the production of this project are provided on screen, as well as linked in this video's description. Thank you for your time, and this concludes the Group 3 presentation.